Despite the impressive progress Malawi has registered to reach the global 90-90-90 targets, some patients are still returning to the hospital with advanced HIV after interrupting treatment. Among others, those patients suffer from opportunistic infections such as tuberculosis, meningitis, Kaposi sarcoma, and pneumonia. It is for this reason that Medicine Sans Frontier, in collaboration with Nsanje District Hospital, rolled out a package of care for patients with advanced HIV called a Circle of Care for Advanced HIV to reduce mortality. One of the patients diagnosed with advanced HIV narrates how he has benefited from the initiative and urges Malawians to report to the hospital once they have developed opportunistic infections such as TB and diabetes.
People from health center said, Austin, you mustn't stop taking drugs. You must continue. Because I was alone, the people, they organized the ambulance and took me to hospital. And I want to thank those people, especially medicines people. I want to tell other people who are suffering from HIV or diabetes not to hide by themselves, must be open.
In his remarks, Deputy Coordinator for MSF Belgium, Dr. Patrick Mangochi, said since the introduction of the program in Nsanje, the percentage of people who are dying from advanced HIV has drastically reduced.
So what we have seen since we started this program in Nsanje is that we have reduced drastically the number of patients that would come with advanced HIV to the hospital by the time that they actually come to the hospital. Within the first 24 to 48 hours. The number of people that are actually died within this period has actually reduced over time. We have data that to that effect. The second thing is that by concentrating on advanced HIV, we've also inadvertently concentrated on delivering of the new messages on HIV to everybody else, so that we could actually exponentially say that a lot more people are actually keen to take the treatments regularly, because we've actually disseminated a lot of messages by meeting the leaders and also over the radios in Nsanje. So a lot more people are actually adhering to their treatments. And more also, a lot more people are actually becoming aware of advanced HIV disease. Because over time, you may agree with me that since the government has put a lot more people on treatment, a lot more patients are actually healthy on treatment. But then by concentrating on those that are really not actually healthy, it has actually pushed in that several other partners as well should put in resources to take care for such patients, because this was not foreseen in the years back, that such resources could be put together to be able to take care of such patients.
Dr. Mangochi further says with the strides Malawi has registered in the fight against HIV, it is possible to achieve the 90-90-90 targets if the initiative is rolled out nationwide.
Malawi as a country is making very good strides in achieving the 1990. This is one of the things that if actually it gets to get the required attention that is actually getting now, because as I speak there is already a subcommittee within the big technical working group in the ministry, under the Ministry of Health, that is looking at developing nationwide program to actually roll the management modalities for advanced HIV nationwide. If this gets to be rolled out, then we are actually going to even achieve more than just the 90-90-90 that we have.
The World Health Organization defines advanced HIV disease among adults or adolescents as a CD4 cell count of 200 cells. Advanced HIV disease includes three categories of PLHIV1 for those not on treatment, Category 2 include those on treatment but the treatment is failing, and Category 3 is for those who began treatment but then interrupted it due to other reasons. Simeon Boyce, NBC News, Blantyre.